UroPatient, tune in and see. Prepare your health for you and me. Knowledge is power. We make it clear every Saturday morning.
Hey, good morning and welcome to the UroPatient podcast. I'm your host, Vic Senese. Hey, don't forget to like and subscribe. We could always use those additional subscribers. So today I'm going to discuss stenting a blocked prostate. So stenting a blocked prostate is an often misunderstood but important treatment option for select men experiencing urinary obstruction due to BPH or benign prostatic hyperplasia. So without any further ado, here we go. Common treatments for prostate blockage focus on relieving urinary symptoms and improving urine flow, most often in cases related to benign prostatic hyperplasia, otherwise known as BPH. Initial management may include medications such as alpha blockers, which help relax the prostate and bladder neck muscles, and 5-alpha reductase inhibitors, a medicine which helps to shrink the prostate over time. There's also minimally invasive procedures like the UroLift, the Rezūm water vapor therapy, or what we're going to be talking about today, the prostatic stent placement. These are options for men who do not respond well to the medications or wish to avoid a major operation. For more severe obstruction, surgical treatments such as transurethral resection of the prostate, otherwise known as TURP, or laser therapy may be recommended to remove or reduce excess prostate tissue and restore normal urine flow. So, what is a prostate stent? Well, a prostate stent's a small tubular medical device placed within the prostatic urethra to hold it open and relieve urinary blockage caused by an enlarged prostate, most commonly from BPH. The stent works by mechanically maintaining an open channel for urine to pass from the bladder, reducing symptoms such as weak stream, urinary retention, and straining. Prostate stents are typically inserted using a minimally invasive procedure, often under local anesthesia, and may be temporary or permanent depending on the patient's conditions. They are generally reserved for men who are not good candidates for surgery or who need an alternative to long-term catheter use. And you can kind of see from this picture here, the stent in the side of the prostate. That's the prostate there, and the stent's that little thing inside there. So a prostate stent is intended for men with significant urinary obstruction from an enlarged prostate, most often due to BPH, who are not ideal candidates for traditional surgeries. This may include older adults, patients with multiple medical conditions, and those who cannot tolerate general anesthesia or spinal anesthesia, or men who have persistent urinary retention and want to avoid a long-term catheter use. Prostate stents may also be considered as a temporary solution in certain clinical conditions, or as palliative option when other treatments have failed or are not appropriate. So I'm going to talk about some of these options that you see up here, describing some of these different types of stents, and we'll go and take a deeper dive into all of them now. So the allium prostate stent, often called the allium triangular prostatic stent or the TPS, is specially designed temporary urethral implant used to relieve bladder outlet obstruction caused by BPH in men who are unfit or unwilling to undergo traditional surgeries. It's made from a superelastic nitinol alloy with a polymer coating that helps prevent tissue ingrowth and reduces incrustation. That's that rock formation that can happen. The stent features a triangular cross-section that better matches the anatomy of the enlarged prostatic urethra and maintains a wide lumen for improved urine flow. Its design also helps preserve continence, that's not leaking on yourself, and patient comfort, and the stent can remain in place for up to about 3 years while being minimally invasive and fully removable if needed. And you can kind of see what that looks like over there. That's our little stent inside the prostate. Now, this is another device called the iTIN, or temporary implantable nitinol device. Again, used for the same reason, to help that open up that prostate. It's made from nitinol. You've heard that word before. Nitinol is this crazy metal that's shapeshifters. It can change shape. And has a shape memory alloy. The device is implanted into the prostatic urethra and expands to reshape and dilate the obstructed area, improving urine flow. Now, unlike permanent stents, iTind is intended for short-term use, typically removed in a few weeks or a few days to 2 weeks, allowing the prostate to remodel and provide sustained relief even after removal. It's often considered for men who are not good candidates for surgery or who want a less invasive option. Though patient selection is important because the device may not be suitable for all prostate anatomies or obstructions. And this one's kind of interesting, as you can kind of see the spring device it's placed inside the prostate. It's allowed to spring open because it's got that memory to the metal, and that will then put pressure against the walls of the prostate. And these little lines that you see, these things here and here, they actually kind of like wear thin lines into the prostate, and that thin line into the prostate is permanent. So it kind of opens up the prostate by having that in there. So by leaving it in for several days up to even several weeks, it'll cause permanent cuts inside the prostate to help it open up. Then the device is removed. Whoopie doopie, you can urinate again. Hopefully. Now here's an interesting one called the Spanner Prostatic Stent. It's a temporary silicone catheter-free device designed to maintain prostatic urethral patency in men with bladder outlet obstruction. Placed endoscopically with the distal anchor in the bladder neck and the proximal anchor. So don't get too confused about these distal and proximal. Proximal is the one way up there and distal is the one way down there. The spanner allows patients to void on their own while preserving continence, not leaking, and normal detrusor function, meaning the bladder can squeeze like the old days. It's FDA approved for short-term use only, typically up to about a month. It's often utilized after acute urinary retention following some other minimally invasive procedure, or as a bridge for patients who are poor surgical candidates, by eliminating the need for an indwelling Foley catheter. The spanner may improve comfort, mobility, and quality of life while reducing catheter-associated complications, though appropriate patient selection is essential to minimize risks such as migration, meaning moving out of where it should be, discomfort, or urinary tract infection. So this one, if you've seen a Foley catheter before, it's like a mini Foley catheter, and it's just long enough to span between, that's your bladder up here. It's got a little balloon to hold it from falling out. You can see those little eyes up there that help to allow the urine to drain. It drains through the prostate, but it doesn't block the sphincter, which is what keeps you from getting yourself wet, and then lowers that little triangle piece that keeps it from migrating up into the bladder. I've never seen one of these in real use, but I have read about them and saw a couple at a recent show. Interesting concept, because, you know, wearing that catheter hanging out of you looks abnormal. This, you don't know. It's all inside. Of course, again, it's only short-term use. Now, here's something called the Pro-V prostatic stent, a next-generation prostatic urethral stent approved by the FDA in December of 2025. Again, designed to gently expand the obstructing prostate without cutting, burning, or piercing the tissue. Early commercial use in the U.S. suggests it can relieve lower urinary tract symptoms and improve urine flow with a favorable safety profile and minimal recovery time. So just another different shape of this type of wire device. And that's what most of these stents are, is just different types of wires. Now here's one called the ZenFlow, a spring-type permanent nitinol stent intended to retract prostatic lobes and maintain urethral patency. Early feasibility studies have shown durable improvement in urinary symptoms out to 3 years, with ongoing research to confirm long-term safety and efficiency. So you can see some of these have very short terms that they can stay in, others longer terms that they stay in and keep that prostate open. It's changing quite a bit. All right, a prostate stent, how is it placed? It's typically placed using a minimally invasive outpatient procedure that can often be performed under local anesthesia or a light sedation. The stent is delivered through the urethra using a cystoscope, that's that tube that we put up through the penis, or a specialized introducer. Sometimes it can be done what we call blindly, without seeing where it's going, and guided into position across the narrowed portion of the prostatic urethra. And you can kind of see from these pictures here how that looks. Once correctly positioned, the stent is deployed, expanding to support and widen the channel so urine can flow more easily from the bladder. After placement, patients are usually monitored briefly for urinary function and may be given some medicines to reduce discomfort or inflammation. Depending on the type of stent, it may remain in place for weeks or months or even longer before the removal or replacement is needed. We mentioned about all that. So what happens after you have one placed? Well, after a prostate stent is placed, most patients notice an improvement in urinary flow relatively quickly, though mild discomfort, urgency, or burning sensation during urination may occur for a short time. If you ever had a cystoscopy, you probably know all those symptoms because they typically happen just from having a scope put up there. Your healthcare team will typically monitor you for a brief period to ensure you can void effectively and that there are no immediate complications such as bleeding or urinary retention. You may be advised to drink plenty of fluids and avoid heavy lifting for a few days, and take prescribed medications to reduce irritation or inflammation. Follow-up appointments are very important to check the stent position and function, and depending on the type of stent, it may need to be removed or even replaced at a later date. So, are there some risks? Of course, everything comes with some risk. Prostate stents can provide significant urinary obstruction relief, but they also carry risk and limitations that must be carefully considered by you and your healthcare worker. Common issues include discomfort, urinary urgency and frequency, and irritation of the urethra or bladder. Stents can migrate. They can move out of where they should be and shift from their intended position. They can become encrusted. That means like covered up with mineral deposits, or they can allow tissue to grow around the device, which can reduce its effectiveness and make removal more difficult. Infection, bleeding, and urinary retention can also occur, and some patients may still require additional treatment or surgery over time. Because of these potential complications, prostate stents are generally reserved for select patients, such as those who are not good candidates for an operation or who need temporary solution while awaiting definitive treatment. They got their place. Living with a prostate stent usually means a noticeable improvement in urine flow, but it can also require some lifestyle adjustments and close follow-up care. Many men experience mild urinary symptoms like urgency, frequency, and slight discomfort, especially in the first few days after placement, which often improve over time. It's important to stay well hydrated, drink plenty of fluids, avoid heavy lifting or strenuous activity initially, and then follow any medication instructions to reduce irritation or infection risk. Regular checkups are essential to monitor stent position and function, and some patients may need periodic cleaning or replacement depending on the stent type. If symptoms worsen, or if there's blood in the urine, fever, difficulty urinating, you should contact your healthcare provider promptly, as these could indicate a stent migration, blockage, or even an infection. So there you have it, folks. Everything you wanted to know about a prostate stent, but were afraid to ask, now you know. All right. So I hope that was informative for you. There's always good information on UroPatient. These stents are just another treatment for blocking prostates. And I had somebody write in and ask more about it. So that's why I decided to do an episode. Hey, speaking of episodes, we got some other stuff coming up here. Next week, we're going to talk about another interesting thing, how if you're wearing a long-term catheter, you can get something called bladder stones on the catheter itself and, sometimes just inside the bladder. So what can you do about it? What's really going on? We're going to talk more about that. And here's another interesting one the following week, in February 14th. I think it's Valentine's Day, if I remember right. What's better on Valentine's Day than talking about circumcision reversal? Is it real? So we've had some questions about that too. So we're going to tackle that. So be sure to join us every week to learn more on the UroPatient podcast. I'm your host, Vic Senese. See you next week.
From research updates to daily advice, Vic explains it all simple and precise. No question too small, no topic too wide. We're your urology partner, right by your side. UroPatient, tune in and see, baby. podcast is here.